Hi, my name is Christopher Cox, and I'm going to talk about hemodynamics and shock. Now, one of the things we find in septic shock is diffuse activation of inflammatory and coagulation cascades, also vasodilation and vascular maldistribution. Now, with that, we have an increase in cardiac output followed by a decrease in cardiac output. Now, with cardiogenic shock, we have an increase in the pulmonary wedge pressure. We also have a decrease in the cardiac index. To monitor with cardiogenic shock, we use an arc line for continuous monitoring of blood pressure, also a central line to measure the CVP. With obstructive shock, we have cardiac tamponade, which is fluid buildup in the pericardial sac. So you have that built up fluid in the heart, so you're going to have increased pressures in the heart. And with distributed shock, we have a decrease in urinary output. So when it comes to the cardiogenic shock and the pulmonary capillary wedge pressure, it's 4 to 12. But we're going to have greater than 12, it's going to be 15. So this increased pressure in the heart is building up. And if one heart has all that pressure and it's working so hard, it can cause that side to fail because it's adding on more pressure than it's usually taking on. You decrease urinary output, 30 milliliters is our norm, but with distributive, we know we have a decrease. So we can monitor that just looking at, measuring how much is coming out of the fluid. And also with septic, we have that decrease in cardiac output, and normal is 4 to 8 liters. And the arc lines, it's good to measure that blood pressure, and that normal is 120 to 80. And also, we talked about earlier with obstructive shock, is also that pulsus paradoxus, so we see that decrease. So this, we can also measure that as well. We can see if that's going on and help us to distinguish with that shock. And what's good about the cardiogenic shock and the Swan-Ganz catheter, which you use, is you can measure those pressures. And I have a picture actually of that to show. Here's a picture of a Swan-Ganz catheter, and that helps you measure pressures within the heart. So we can kind of see whether or not they have certain types based on the pressures and also the issues going on within the heart. So that's hemodynamics and shock. And my source for that was emedicine.com.